of combating the spread of this virus so far. Prepare, but do not panic has been increasing restrictions on the system, including through training our medical staff across the country.
The second and third order impact of this, particularly on poor and vulnerable and women, is very significant. If we could create a common framework for telemedicine, for diagnosis of related issues, and as advances take place, how to be able to coordinate. Third, as a landlocked country, which is simultaneously the heart of Asia, closing of borders where essential will result in significant problems regarding availability of medicine, food, and basic goods. Can we coordinate to be able to create controlled flows that both allows transactions to take place while focusing on the essentials? The fourth issue for us, Excellencies, because, in all Excellency, because we've cancelled schools, prayers have been stopped. How do we keep women, youth, and children occupied? Since India in particular and South Asia are leaders in distance education and self-learning, can the SAARC satellite and India's satellite be made available so we can keep people, because social distancing that is necessary cannot just take place. And my fifth proposal, Prime Minister, distinguished Prime Minister, since India is both a very important member of SAARC and a member of the Shanghai Council, Cooperation Council, in Shanghai, both with China, that is our deepest sympathies, in Iran. Can we coordinate while learning, particularly from how you upscale the existing programs? We have a program.
Begin by thanking Prime Minister Modi for this timely call for a regional initiative to combat the increasing threat of COVID-19 in the. This is extremely costly to Prime Minister Modi and the people of India. We have received medicine. Every other job creating and revenue generating activity in is either directly or indirectly dependent on the tourism. Is now facing a serious shortfall in foreign currency earning, estimated to be at $450 million. In the foreign currency, detrimental impact on the Maldives economy, which has I am therefore in full agreement with Prime Minister Modi on the need to formulate a comprehensive regional strategy. Such a strategy should, we believe, comprise three key elements. First, we should create space for closer cooperation between the health emergency agencies.
Thank you, Excellency. Now I request His Excellency President Rajpaksha to share his thoughts.
Good evening, Excellencies. First, I must thank Honorable Prime Minister of India, Shri Narendra Modi, for initiating this video conference to share our number of Sri Lankans working especially in Italy and South Korea. We cannot stop our Sri Lankans coming back to their home country. We have therefore taken all steps to subject those returning to Sri Lanka to restrict social gatherings. We have advanced the usual April school holidays to commence from 11th March. Further, we have closed universities and other educational institutes, also with the aim of minimizing social interaction. Our first case was reported in Sri Lanka, was a Chinese lady tourist who since has been cured and already left Sri Lanka. The first Sri Lankan to be infected, this hospital has successfully treated even the first case reported. In all other hospitals designated to symptoms have also been strongly advised to be subject to self-quarantine. The area police and the public health inspectors are closely monitoring the progress of the suspected patients. Public health inspectors undertake daily visits to check on these persons who are self-quarantined. We have also established a national task force comprising all major stakeholders with the power and authority to take crucial decisions have been set up and meet on daily basis with close and constant monitoring of all aspects relating to the spread of this deadly virus. A 24/7 office with hotlines has been established to coordinate all activities related to battling the spread of the virus, quarantine and testing and treatment of suspected and confirmed cases. Government of Sri Lanka has taken some additional steps to effectively meet this unforeseen disaster to be followed for prevention of the spread of the virus. This is done through mass media, presidential media division, press briefings, press bulletins, etc. General public were educated not to go for panic buying of face masks, hand sanitizers, etc. This was quite effective. 12 hospitals were declared as suitable for caring of possible coronavirus affected cases across the country. Managing of stocks of personal protective equipment such as masks, gloves, sanitizers and other medical items required for treatment of patients also started. Since the high risk area for the coronavirus was the city of Wuhan in Hubei province in China, there was a requirement to evacuate 34 Sri Lankan students and their families back to Sri Lanka. This was done by the national carrier Sri Lanka Airlines, which flew from Colombo to Wuhan and back to Colombo with all 34 passengers. These 34 students on arrival were immediately quarantined by the Sri Lanka Air Force before they were elections will be held as planned. When the World Health Organization, WHO, declared COVID-19 as pandemic and indicated that fundamental public health interventions can still limit the spread of the virus and drive down cases even where it was transmitting widely. Advisories were issued for travelers and precautionary measures were taken by limiting travel overseas of Sri Lankans unless it is essential to do so. Almost all major sporting events international conferences, meetings, large gatherings have been postponed or cancelled. All schools, universities and other educational establishments, including preschools throughout the country, has been closed for particular periods ranging from 2 weeks to 6 weeks. Even gatherings for religious purpose have been stopped by respective religious leaders, initially for 2 weeks. Also, issuance of on-arrival visas has been suspended for all countries. Travel advisories sent to airlines not to uplift passengers from several countries, mostly from EU countries. Travel advisories also sent that any passenger coming from countries which we have defined will be quarantined for 14 days in Sri Lanka. Sanitizing of public transport also commenced from 2 days back. So because of these reasons, our economy has taken a severe blow due to the coronavirus, particularly in tourism. Most of our tourists are from Italy, Germany and other EU countries. And now there is a ban on their coming. Our tourist industry was just recovering after last year's April 21st terrorist attack. Our exports are also adversely affected. Therefore, I strongly recommend the SAARC leaders to formulate a mechanism to assist our economies to tide over this very difficult period. I also wish to recommend that a SAARC ministerial level group be established to discuss, share best practices.
Quarantine period. We need to devise a strong SAARC-wide strategy to fight this public health threat and to protect our citizens. We successfully prevented entry of the virus through strong surveillance and rigorous checkup at all international airports, sea ports and land ports. We had only 3 COVID-19 imported cases. They have already recovered. There are 2 new imported cases from Europe. We have no local or community transmission of any COVID-19 case. We have set up a national committee to provide guidance to concerned people from all ministries at all levels. We have also undertaken massive awareness raising campaigns everywhere in Bangladesh through all available medias, including social media. My party workers at all levels are active in awareness raising. Local body representatives are vigilant to enforce home quarantine if health workers at Upazila levels. School children are also being trained to follow necessary personal hygiene. We have stockpiles of testing kits, infrared thermometers, isolation gowns and masks. Excellencies, I have some proposals that all SAARC countries need to cooperate and collaborate closely to fight this pandemic. We need to force collaboration through our collective capacity, expertise and resources. We are ready to share our capacity and expertise as well as the best practice with the SAARC countries, including providing logistic support if required. To continue this dialogue at technical level, our health ministers, health secretaries, and relevant health experts can also have this kind of video conferences to discuss specific areas of cooperation. WHO Southeast Asia Regional Director may be invited to these video conferences. We believe it is extremely important to establish an institution to prevent and fight against any public health threats in South Asia. Problem arise, we can work together and we can exchange or share our experience. And Bangladesh will be happy to host such institution if you all kindly agree.
Right Honorable Prime Minister Sri Narendra Modi ji, distinguished heads of state and government of SAARC member states, Namaste, and efforts will help us devise a sound and robust strategy for the SAARC region as we fight the COVID-19 pandemic. I wish to thank Prime Minister Modi ji and all the distinguished leaders of SAARC member states for kind words and best wishes on my speedy recovery. Even though we had detected one suspected imported case, but the COVID-19 test proved negative. Yet we are aware of the high risk of possible outbreak at any time. We remain alert from preventing it. We have taken several measures to enhance our preparedness. Our efforts at the moment are geared towards preventing this disease to enter into our country. Our national efforts, I am personally overseeing and guiding the government efforts. Multi-agency coordination committees have been set up at the center, provinces and local levels to mobilize government efforts in the synergetic manner. We have restricted international movements. Visa on arrival facility for all foreigners and non-resident Nepalis with foreign passport has been suspended. Movement of this country, movement of third country nationals via land routes has been suspended. Swab test PRC health certificate is made mandatory to obtain visa from Nepali nations abroad for essential travels to Nepal. We have suspended issuance of work permit for Nepali nationals for overseas employment. International passengers are required to go through the screening process at the health desks at the international airport. There are provisions for self-quarantine for certain categories of travelers. We are strengthening quarantine facilities in all provinces, hospitals, and arranged isolation wards and intensive wards for treatment. We are enhancing capacity of hospitals. Health workers are being provided with personal protective equipment and necessary incentives to motivate them. All the permits for mountaineering expedition for spring 2020 have been suspended and all major international conferences have been postponed. Okay. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Prime Minister Dr. Lote Shering, who is an experienced surgeon. Prime Minister Shering, we are all keen to hear you. Please.
Thank you, Your Excellency. Before I start, I would like to take this opportunity to convey my King's greetings to all the heads of the states and heads of the governments here. As we speak, my King is out of the capital. He is in the district places, ensuring healthcare services, ensuring COVID-19 surveillance system, and trying to motivate our healthcare services and service providers, as well as asking all the people of Bhutan to be on the same page when this pandemic strikes Bhutan. So with this, I also would like to take this opportunity to express my King's greetings and greetings of all of us to Prime Minister Oli for his speedy recovery. And similarly, we also would like to wish Prime Minister Hasina for her father's 100th birthday celebration in few days. So with this, I would like to thank Prime Minister Modi for your excellent leadership to bring all of us together, because togetherness is required at all times. But when the whole world is fighting one common disease that we cannot see with our naked eyes, I think it's very important that all of us come together and leave behind our differences. And number two, I think it is very important that we communicate very clearly on this. Communicate between all the leaders of the world, communicate between central government with local government, communicate with the health planners and the people of the nations. So I think this is very timely, and I would like to thank Prime Minister Modi ji for your excellent leadership on this. To tell my colleagues on the experience of Bhutan on the lone COVID-19 positive that we had, it was the 5th of this month, last 5th of March evening, we had one lone imported case. A Bhutan lover, a Bhutan visitor who wanted to visit Bhutan came to Bhutan, and then on the 3rd day of his visit, he showed some very abnormal signs, symptoms, and then on suspicion, we found out that he was COVID-19 positive by evening. Yet we wanted to confirm it, and the confirmatory test came just before midnight, around 11:30 p.m. By then, our health officials had all gathered in the ministry. Even my king also came to the ministry, and we all started because we knew that we had the first confirmed positive case. So throughout the night, we worked very hard. Our surveillance system that was already in place was initiated, activated overnight, and starting midnight till 7 a.m. the coming morning, that is 6th of March, we managed to trace the whole path of the first positive case. We managed to identify all the 48 primary contacts. We managed to send all the contact tracers and surveillance team to their respective places and inform them of the importance of house quarantine that first morning. And then as the day unfolded, we managed to pull them out and bring them to the formally identified quarantine facilities. So over 78 hours, we managed to identify all 48 primary contacts from 3 different parts of the country wherever our tourists had visited. And we managed to initiate the medical team that we had identified to treat in case if he had a positive case. And then he was isolated and treatment started. And it all happened because our health ministry under Minister Dishen's leadership, everything was planned beforehand. And then our king was also awake the whole night trying to causes that we brought in. From there, we managed to treat him, take care of him very, very well. And his family wanted the patient back home. So he was successfully proposals that were made before me, and also to be very, very sure that we all will share our limited resources that we have, share the technologies that we have, and also to have frequent such meetings so that with the changes in
Dr. Jafar Mirza, who also has medical experience, to share his thoughts.
Bismillahirrahmanirrahim, and Assalamu alaikum to honorable heads of state and government and Secretary General SAARC. First of all, I would like to wish good health to His Excellency Prime Minister of Nepal. Your Excellencies, the COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are put in place. With over 150, Pakistan shares the common concern over the potential of COVID-19 affecting South Asia. All our countries now have confirmed cases. Mercifully, the SAARC region has so far evaded the worst ravages, but given the experience of other countries in other continents, there is absolutely no room for any complacency. While hoping for the best, we have to prepare for the worst. The World Health Organization's four-pronged advice offers a reasonable way forward, namely, A. Prevent, B. Detect, C. Respond, and also D. Conduct research and innovation along the way. Excellencies, Pakistan has been involved in containment efforts right from the outset of the outbreak. We have been alert to the dangers and have put in place appropriate public health measures and developed required protocols and guidelines for the safety of our people. We have been matching our measures to real-time risk assessments. While we have stressed the need for prevention and caution, we have strongly advised against panic. A calm, calculated, and deliberate response is the need of the hour. Pakistan was among the first few countries to undertake a joint external evaluation for the state of preparedness to cope with health emergencies in the context of International Health Regulations 2005. In close collaboration with World Health Organization, we have been taking steps to appropriately restrict movement to and from the affected countries, regulate for flights, institute health screening measures at entry points by member states, and establish quarantine/isolation facilities. Diagnosed cases are being isolated and contacts are being traced proactively. Prime Minister Imran Khan is personally overseeing these efforts. Resultantly, Pakistan has managed so far to keep the cases to a relative minimum, an achievement that WHO has recently recognized as a good practice and has commended it. National Security Committee recently convened for the first time on a national health issue, chaired by the Prime Minister Imran Khan, and has decided to take major steps to contain the spread of COVID-19. The four pillars of our response strategy include: 1. Governance and financing, 2. Prevention, 3. Mitigation, and D. 4. Communication. We have decided inter alia: 1. To close all our educational institutions for 3 weeks, close the entire western border for 2 weeks, restrict international flights to 3 airports only, and to ban all large public gatherings, and reinforce screening and administrative measures at the seaports and at the ground crossings. The situation is being monitored closely, and appropriate measures are being taken through a systematic consultative review process. The National Disaster Management Authority has been mandated to lead the interagency effort, and command and control centers have been established at the federal and provincial levels. Effective coordination and surveillance at all levels is critically important. Excellencies, the COVID-19 pandemic forces us to think not in terms of nations and states, but as a collective. If our health systems, disease surveillance systems, and preventive measures are unable to cope, the human and economic cost alone can be staggering. The cumulative impact will dampen region-wide growth prospects and negatively affect the national development agendas. At their current stages of development, the SAARC members can ill afford such a setback. The unprecedented challenge therefore warrants an unprecedented response. We must recognize that the national and local responses still remain the key, and they are the most critical. SAARC Health Ministers Conference at an appropriate time. 3. Reach out on behalf of SAARC countries to specialized development partners, including World Health Organization, for mobilization for technical advice and resources. 4. Follow WHO guidelines and implement exit health screening for travelers in the region to avoid cross-border spread. 5. A regional mechanism is proposed to share disease surveillance data in real time about prevalence and incidence of communicable diseases and public health events of regional significance. And lastly, learn from and disseminate the experience of SAARC observer states, particularly China. No doubt,
Based by coming together, not growing apart. Collaboration, not confusion. Preparation, not panic. In this spirit of collaboration, emergency fund, this could be based on voluntary contributions from all of us. India can start with an initial offer of $10 million. Our foreign secretaries, through our